Welcome to In the News with Double O Des. I'm Des Bernardo, giving you my perspective on news from South Africa and the rest of the world.
In the news now, I want to cover an article that is related to many of the articles I've covered before on COVID-19. And the importance of this article specifically is with regards to not only statistics, but predictions and predictive modeling. And in this article that's in my broadband, the headline is COVID-19 in South Africa, predictions versus reality. And this is a very important thing to consider, that our government has gone out and actually done things based on a predictive model that I've covered before and said that it was completely and utterly flawed. That Professor Mahdi, who's at the forefront of actually developing treatments for the COVID-19 disease, has said that it looks like it was scribbled on the back of an envelope, literally, the calculations, just in concept, that it wasn't properly found in science. And it's important to understand that we were locked down based on those presumptions. And now government, they were always going to be uncovered with regards to this. They could never hide from this, and they would use the media as their best source of hiding this. And I will do one more article on that today, where they are trying to justify now, the World Health Organization, that they classified this as a pandemic because they know that this is going to come back to knock them for a six. And they have now asked for independent people to actually examine their actions. Politicians, not scientists. And this is when the red flags go up. But this article is going to knock the socks off you. And I will put the link in the article underneath this video. You need to go and read through it. I'm not going to cover everything in detail. Read through the article and actually look at what this means, okay? There's very nice graphs put out in this article showing what the predictive models were saying, what is actually happening in the country, and we are having a linear increase of cases within South Africa. There is nothing exponential happening whatsoever, so everything they've predicted was utter rubbish, wasn't based in science or in fact at all. So let's get into the article. Pandemics Data and Analytics PANDA, okay, this is an acronym, coordinator Nick Hudson has slated South Africa's COVID-19 modeling, which he said amounts to scaremongering. Now, I've used those words many times before. Once again, I do believe the virus is real. I do believe that it causes conditions within people. They have coined this COVID-19 without really understanding what it is. People are starting to understand what it is now and are coming up with treatments with current medication that we have to actually be able to treat COVID-19 patients, which means someone that has developed COVID-19 from contracting the SARS-CoV-2 virus. In his latest article, Hudson said that, and I quote, just as one group of modelers goes to ground after getting things catastrophically wrong for foreseeable reasons, a new one emerges to repeat the trick. Close quote. So government will always find one idiot and then they'll find the next idiot once again. This is basically what he's saying. Hudson is referring to a modeling which predicts that, and I quote, the Western Cape is about to be ravaged by COVID-19. Close quote. He previously highlighted that the official modeling of South Africa's projected mortalities from COVID-19 started at 375,000, which was completely wrong. And I covered this before in numerous articles, and you can go and find those under the In the News series. The exaggerated mortality figure, and I quote, scared the living daylights, close quote, out of President Cyril Ramaphosa, which he said resulted in a strict and prolonged level 5 lockdown. So this was a reason for our government doing what they're doing. He said that over time these forecasts have been significantly reduced to 40,000 mortalities. Now 375,000 versus 40,000, that's almost a factor of 10, the difference. Insanity. Hudson has now shifted his attention to the latest Western Cape modeling, which shows that the province has not reached its peak yet. Western Cape Premier Alan Winde, someone that shouldn't be in government, sadly, poor guy, recently said the peak in the province seems to be later than was originally projected. Nothing they've projected has been accurate. Nothing. And the problem with this is, when something bad really comes along, will the people follow it or believe it? Something that could kill millions. The people will just use the cry wolf mentality and say, stuff it, we're not going to believe government. And that's bad news. Because something bad can really come along and kill all of us, be a real threat, where we actually need to be in these severe lockdown conditions, maybe even more stringent. Western Cape Premier Alan Winde recently said the peak in the province seems to be later than was originally projected and is likely to take place from end of July to beginning of August. Now, in August he's going to say that it's late again, and in September he's going to say it's late again. At some point he's probably going to say, well, I'm looking like a fool now, maybe I should just shut my mouth. Because he's listening to other people, because he's not a medical expert. But anyone that's elected into office in government should be able to question these people and say, listen, you're telling me rubbish. Bring me proper facts. Show me the science and have a brain to dissect it and actually think whether this makes sense or not. That is why you are elected into office. But that's not the case at the moment, is it? Because you weren't directly elected. There's a party that chose you. Out of a whole bunch of really bad candidates, you were the best. He further said this peak is flatter than was originally projected, but would last longer and result in, and I quote, potentially more cumulative deaths of about 10,000 people during the pandemic, close quote. He doesn't know. These are all predictions. I quote again, the virus could be with us for longer than we thought. Now, how long did he think the virus would be with us? No one freaking knows. There's no person on this planet that knows. With his first peak only ending towards the end of November, close quote, said Winde. Hudson slated this modeling, saying confirmed COVID-19 cases, hospitalizations, ICU admissions and deaths are all slowing down in the province. And he quotes, I quote him, the good news is that the Western Cape has passed peak mortality. Our healthcare services have withstood the onslaught and we are on the way out of this nightmare. Close quote, he said. I quote again, our healthcare workers have learned how to deal with the COVID-19 scourge and can now help the rest of South Africa. Close quote. Now, something I haven't told any of you up until now is that my oldest daughter is actually emergency medical practitioner. And she has confirmed to me that in the hospital where she works, where 90% of the cases are COVID-19 cases, people that have developed the disease due to comorbidities, that they have developed the proper treatment now to help these people. It's not going to save all their lives, but that there are things that can be done and that they've got this figured out compared to when things started originally. And many things like intubation and so on, we know from overseas, were actually killing the patients. So a lot has been learned up until now, and there's a lot more success rates with people that actually get really sick, with the new symptoms that's presented with the SARS-CoV-2 virus. So this is what he confirms, that our healthcare workers have learned how to deal with the COVID-19 scourge. And I can say that that is true based on what my daughter's told me that's working on the front lines. She's already been SARS-CoV-2 positive. She didn't have it bad. She's still young and strong. And she's had people around her in the medical fraternity, other nurses that are HIV positive and other people that are old and more frail that have sadly passed on from contracting the SARS-CoV-2 virus. So the healthcare workers are working under very difficult conditions, and we should be thankful to those people that do put their lives on the line, because they have to work in the harshest conditions. A lot of them don't actually have new equipment that they can replace all the time, and this is how some of the contamination takes place. To support his views, Hudson compared the 12 June modeling consortium projection, which is used by the Western Cape, with PANDA's own model. So he's comparing their model with this model that the Western Cape government is using now. And I want you to go and look at the graph so that you can actually see what's happening. He said the modeling consortium's projection, and I quote, is hardly a projection predicting 2,600 to 9,000 deaths in the Western Cape by 15th of July. The model has already fallen below its mid-low confidence interval and is heading below its lower bound by 13th of July, just a month in. Close quote. Which means that they know that they're already wrong. So why do they keep on using this rubbish? PANDA's Koeberg's projection, which was released on the same day, predicts a narrow range of 2,300 to 2,900 deaths by 15th of July. This has been 100% accurate. So what Hudson is saying is that their model's been right. So it's proven to be right based on evidence that the other model the Western Cape government is using to create fear-mongering is wrong. And you can see it with the evidence. I quote, "Actual deaths are currently tracking straight down the middle. This shows Western Cape mortality has already peaked." Close quote, said Hudson. Now that's what the evidence is telling us. If that changes, the evidence would be different. The charts below show the two predictions compared with the actual deaths in the Western Cape. So there's the chart of South African COVID-19 Modelling Consortium prediction, which is completely off the beaten track. They've lost complete and utter understanding of what's actually happening. And then the PANDA Koeberg's prediction, which is spot on. Okay, so you can go and look at it for yourself. Now, I'm not going to go into the rest of the article. You can go into the rest of the article. What's basically happening is there's one predictive model that's correct, that's not being used by the Western Cape government, another predictive model that's completely wrong, and it's going into a log scale when the rates have actually flattened out. Now, when it flattens out and it's linear, the increase, it means that you're beating it. That's what the evidence presented actually tells you. And this is based on simple math. It's not rocket science. It's simple. So there's good news for the Western Cape. It looks like that we've reached the peak in the province already, although the Premier of the Western Cape, Alan Windey, is saying and singing a different tune, even when the evidence suggests something else. So this is very important and very significant. Once again, this virus exists. I believe it's existed for a very, very long time, in fact for decades. There might be different iterations of the virus, but it's been with us for a very long time. Maybe not present in the population, but in existence certainly. The one thing that I also believe is that the virus is meant to actually kill people with comorbidities, the sickly. And this is exactly what it's done. And people that are healthy and strong have managed to deal with it better than most, and that is good news for society. Still, in any societal circumstance, you should practice cleanliness, washing your hands. I'm not saying don't get dirty. My kids get dirty all the time. That's how they build up good and strong immune systems. But do wash your hands when you've been out into public. Stand away from someone that's coughing and sneezing. This is normal. This shouldn't be rocket science, really. Even people with flu can end up killing you if you have comorbidities. This happens all the time. So it's important that people use normal hygienic practice. Okay? But to call something like COVID-19 something that it's not, because we have evidence now, we have better ways of treating the symptoms displayed from contracting the SARS-CoV-2 virus, although people are still trying to understand exactly what it means to contract COVID-19, all the different things that present. There's certain things that are pretty solid and certain by now, okay? And there are treatments for that. There's more success. So what does it mean for the population at large? Government needs to come clean and give us the facts. The simple facts, not predictions. Give us the facts and make decisions based on that. I believe they've already done a lot of that. I don't know why they're calling the current lockdown level 3. I think it's because they just want ammo in their back pocket to try and wrench a few more things out of us. But we are actually mostly at level 1 at this point in time, based on their original plans for coming down from level 5 to level 1. So they're not being honest with us, and it's time they just become honest. People aren't stupid. People can read things like this, and I do recommend you actually look at the article, especially at the graphs, to see what is actually happening. I thank you for this. The next two videos, The first one will be on the water situation. The next one will be on the Rothschilds. You can look forward to that. I'll be busy with those up until later this evening. I thank you very much.